Today I want to talk briefly about the challenges people go through as they try to seek mental health services. One is stigma. There is still a lot of stigma that is related to mental illness or to someone who is mentally challenged. You realize that when someone get to know, even maybe when they listen to the things we tell them, the person will still fear to come out and say, oh, I think I could be going through a mental challenge. Because they think when they come out, they are going to be stigmatized, they will be talking about them and all that. So that is one of the issues that stop people still, or maybe makes a low turn up for people coming to seek for mental health services. But I would like to request everyone, please seek for mental health care services when you're not feeling okay, because most of these signs we always highlight them, and I'm going to the next video I will do on the major signs and symptoms of mental illness. Two, we have lack of awareness. So many people still don't have information on mental health issues. However, we are trying to create awareness. Sometimes we go for radio talk shows. Sometimes we do it in the hospital setting or in the facility setting, or maybe in the community or some small health centers. It's really still a challenge. Very few people still don't know what is mental illness, what is mental health. And this calls upon us that we can always even try to seek for more information. Even when you Google, you'll be able to find some information on mental health, what is mental illness, and the challenges. Here I've also said myths about mental illness. So many people still have wrong information and they believe in things that are not right. For example, someone can be saying that I'm being charmed, I'm being bewitched, that's why I'm going through a mental challenge. Or which in the reality, it doesn't exist in the medical field. Because when you bring your client to the health worker, they're going to sit with you. They try to look at the signs and symptoms, and then they ask you about the family history, and they try to get to know more of the history, that the medical history and other things that has been happening with your relative or your loved one, so that it enabled the health workers to diagnose the patient correctly. So there are certain things we need to sit down and accept it, that this is the fact or the reality. Because however much we live in denial, the patient will continue getting sick, and instead of bringing the person to the hospital, some will think of other options, going to church, maybe going to a witch doctor. We don't stop people from trying all this, but I think the basic thing is the hospital, so that your patient gets better. And where you can ask more questions and you'll be highlighted, and you go home when you're more satisfied with the information. And then we have lack of family support to the affected family member. You realize that some of the family members, when someone is already mentally challenged, they cannot think clearly, they cannot follow, or maybe they have poor memory issues, especially if someone is maybe going through depression, or maybe they're already at their lowest moment, they're in crisis. They are not going to remember what the doctor told them about their medicine. And that's why we asked a family member to always escort a client to the health facility, so that the patient is guided together with the caretaker. So you realize that most people still, you see patients coming on their own, and you wonder if the patient is going to remember what the health worker told them about their medicine. Another thing is the negative attitude towards mental health or mental challenges. I mean, people will start to think, if you have ever suffered from mental illness or you had a mental challenge, you cannot function like a normal person. Maybe you cannot marry, maybe you cannot raise your children, or you cannot live like a normal person. What I would like to assure you people is someone who is going through a mental challenge can still function normally, provided he or she is on their medication. They need to take their maintenance treatment to make them be able to do their normal work like any other person. Because the medicine will take away all the signs and symptoms of mental illness, and nobody will know that you're going through that. And that's why it's very important when you've been diagnosed already with a mental challenge for you as a patient to take your medicine, so as you avoid the stigma that will come along. Thank you so much for today. That was the short clip I've prepared for you. I hope you enjoy your day.